I know that sometimes even some of the other high-level clinicians like yourself that we've interviewed for this, there's always a level of frustration and something they want to tell their other fellow clinicians that might try to cut corners or might not try to do it right. If you had another clinician watching this or a group of clinicians, what would you like to say to them?
Knowledge never ends. So how many times I changed my techniques and developed it? I will not be exaggerating if I tell you every single surgery. Every surgery you do, you know more, you learn more. Matter of fact, sometimes my frustrations comes the more I learn and read and watch. I feel so way behind. I still have a lot to do. So never think that you got it all. It will never get it all. You always keep improving skills and techniques and extraction and suturing and loading. It just never stops. Never stops. I don't say like after 10 I will be confident. After 100 I'll be confident. No. The more you do, by the way, the more that you know that is still a lot to learn.
When, in your opinion, so this is just opinion, in your opinion, when would a clinician be ready to start doing these type of procedures?
No, this is a long story here. No, again, this is full mouth reconstructions. Before you go with the full mouth implant placement, you need first to learn how to place one implant, and graft it, one implant grafted with immediate loading, a couple of implants together at the same time, multiple extraction. It doesn't go like I'm going to do All-On-4. It doesn't work this way.
Exactly.
No.
Exactly. No. So you just keep walking us through it. So now they have to do multiple implants with some grafting. What would the process look like? Where do they get to? So they've already done everything that you said, and they've done some of them. Keep going.
Okay. Single, multiples, full mouth reconstruction. I mean, start planning to know. I mean, it's steps.
Yeah.
When I say like we remove all the teeth and we place implants, right?
Yeah.
Imagine that each one of those is a case here. This tooth number, whatever, it's pulled and placed and grafted. Imagine that you need now, within a couple of hours here, to do 5-6 procedures together.
Right.
And connected.
Right.
Because at the end you have one prosthesis going in, planned. So this kind of like training, we give it in courses, like long courses.
Yeah.
Extensive. It's not that simple.
Yeah. I guess coming at it, what I'm trying to do.
I have been there, single implant first, then couple. I mean, like I didn't go do this all of a sudden. No, it takes steps.
Right. Right. And I guess that's part of what I'm hoping to convey to some of these doctors out there. Because I know from a business standpoint why it looks attractive. I do. I understand why it looks attractive. From a patient and a clinical standpoint, it's very complex. It is.
But it's doable. Okay, it's very doable. Just don't go to the next level without finishing level 1. Finish level 1, go level 2. Finish level 2, go level 3. But don't jump from level 1 to level 5 and say like, I'm gonna do it. It doesn't work this way. No.
Right.
This is higher levels. Before we get there, we have to pass through the first few levels and master it well and do it right and then go to the next level.